If you have a healthy and protective gut and a protective vaginal microbiome, then you just decreased the risk of the pathogens passing those two barriers in order to get to the bladder.
Hi, welcome back to the Live UTI Free channel. My name is Melissa, and this is a follow-up interview with Dr. Krystal Thomas-White. If you haven't seen our first interview with Dr. Thomas-White, check it out. The link is in the video description below. If you enjoy these videos, think they're important, and want to support what we do, be sure to hit subscribe and tick the bell so you'll be notified of our future content. Thanks again for joining us on this journey to making change in women's health. Today, I'm chatting with Dr. Krystal Thomas-White, who is our scientific advisor here at Live UTI Free. She's also the senior scientist at Evvy. Dr. Thomas-White is a microbiologist specializing in the female urogenital microbiome and how it relates to disease. Thank you for joining us for this follow-up interview so you can answer more of our community's questions.
I'm so excited to be here. I always love talking with you, talking with the Live UTI free community.
Yeah, and we love having you as well. And I think a lot of people watching this probably aren't aware of who you are. So if you could provide some background on your work and your research, that would be really helpful.
Yeah, be happy to. I did my PhD in the Wolf Lab, which was the lab that really was able to show that urine is not sterile. And I was able to be a part of discovering for the first time or actually first time in the modern day, that there is a urinary microbiome. And we looked at a lot of how the microbiome was associated with health and disease. I did my dissertation on the connection between the vaginal and the bladder microbiome. So we're actually able to see that the exact same species and strain of bacteria are present in both the bladder and the vagina in individual women, which says that it's a whole interconnected microbiome, not two disparate locations. After that, I went and studied post-microbe interactions at Stanford, and I'm now at Evvy, as you mentioned. We are a at-home vaginal microbiome sequencing company. So my job is to do a lot of, we're a startup, so I wear a lot of hats, but I do everything from making sure that all of our content is scientifically accurate, as well as working with academic collaborators and actually doing science on our samples.
And so what has the research said in terms of what a healthy vaginal microbiome looks like?
Yeah, the vaginal microbiome and the bladder microbiome, they're actually very similar. As I said, they are connected. Tends to be lactobacillus dominant is considered healthy. And by lactobacillus dominant, there's 4 main ones, and I'll say them in order of what's considered best to worst. Lactobacillus crisphatus, Lactobacillus gasseri, Lactobacillus jensenii, and then Lactobacillus inners. And what we know is that crisphatus and gasseri can actually kill off pathogens, push out other pathogens, so they just take up all the space, so pathogens can't like colonize. They're also producing chemicals that can kill or inhibit those different bacteria. Whereas, so they're considered very, very good. However, Lactobacillus inners is kind of a tricky one. It's just a bystander. It doesn't produce a lot of those chemicals. Sometimes it's healthy, sometimes it's not. Sometimes you only see it in moments of transition, that type of a thing. So that's healthy. Do you want me to also talk about disease?
Yeah, of course. That's very important for this community.
Yeah. So that is what is considered healthy, is lactobacillus dominant. What is considered unhealthy is a more diverse microbiome with lots of different bacteria present. So Gardnerella, Prevotella, Mobiluncus, a whole bunch of anaerobes, those are considered the pathogenic bacteria in the vagina that can cause a lot of symptoms like itchiness and smelly discharge and that type of a thing. It's also the profile of microbiome that's been associated with a whole bunch of adverse outcomes. So things like STI acquisition or cervical cancer progression, those types of things. So that's the dogma in the field. That's like the dichotomy that we, all the literature is kind of based off of. But I do want to mention that that is an imperfect model, because what we see in our data is that no matter what profile you have, we find people that are symptomatic and lactobacillus dominant or asymptomatic and diverse.
Yeah.
So it is a lot more complex than that dichotomy. And for anyone who falls in the diverse category, I definitely want to tell you, if you don't have symptoms, there's not as much to worry about, right?
Right.
And we're trying to figure out what is a protective microbiome that isn't lactobacillus. What
Yeah.
might that look like?
Right. I mean, that's all like important information, and it covers some of the questions that we have in the list for today. And one of the other questions was, do biofilms and intracellular bacterial communities exist in a healthy body?
Great question. I'll start with biofilms because I think that's a little bit more known.
Hmm.
Um, I think of a biofilm like a apartment building where bacteria have built up this kind of hard wall that protects them from the outside environment, protects them from hormones or antibiotics, or in our case, if thinking of the uh, analogy, it protects you from the elements, right?
Hmm.
And but that is just the structure. And there's a lot of different things that can live in that structure. So in a bacterial vaginosis or diverse vaginal microbiome state, there's not just one bacteria in the biofilm. There's Gardnerella, Prevotella. There's all sorts of different. It's called a polymicrobial biofilm, and it has a very particular type of structure. So Gardnerella produces one type of biofilm, whereas other bacteria might produce others. But biofilms are also present with lactobacillus dominant
Hmm.
profiles. So lactobacilli can produce their own matrix that can create its own biofilm. And there's really cool research happening that shows that like certain molecules that different lactobacilli make will promote other lacto to produce a biofilm. So they're kind of,
Hmm.
again, it's this community-based colonization of a particular niche.
Hmm.
So yes, they can be good and they can be bad. Um, but from a bacterial perspective, and that's kind of, I'm a microbiologist, so I think from a bacterial perspective, you're building yourself a nice protective structure that, helps you survive. So of course, there's going to be lots of different bacteria that can
Hmm.
do that.
So it's more about what's in the structure than the structure itself.
Potentially, although there is some work looking into the components of the structure, and that might be either like pro-inflammatory or maybe more resistant to antibiotics or something
Hmm.
along those lines. But that's very, very early research.
Okay. And in your
Yeah,
research at Evvy, have you found anything unusual in the vaginal microbiome that wasn't known about before?
wasn't known about before. Um, I guess it depends on what your definition of known about before. So
I guess common knowledge in association with the vaginal microbiome.
let's see. Um, there's not uh, particularly new species or anything like
Hmm.
that we found, right? Um, I think that they're there, but we just haven't had the time to really dig into, you know, naming new bugs and getting that out in the literature. It actually takes a lot of work to do.
Yeah, I bet.
We've been more interested in understanding how the composition might interact with or is associated with different symptom profiles and treatment
Hmm.
responses. And I think the most surprising thing was kind of what I was describing earlier is that we have people that are symptomatic that look like the canonical healthy, and people who are asymptomatic look like the canonical unhealthy.
Yeah.
And really teasing that apart is part of the challenge.
Hmm.
Um, there's I don't know, this might be a tangent, but in Winnie the Pooh, there is a story
Yeah.
that Winnie the Pooh is walking around a group of trees in the snow,
Hmm.
and he's following footsteps, and he's wondering who's making those footsteps, and then he realizes there's more footsteps that are coming and more footsteps that are coming, and it's not until the end of the story you realize he's just following his own footsteps he made last time he
Hmm.
circled the trees. Um, and that kind of happens in science too, right? Everything that we do is informed by the things that happened before.
Yeah.
But sometimes you have to question what were the biases in intentional, unintentional, inherent in the data, whatever it might be, but what are the biases that that foundation might have been built on, and how do we get past those as we move forward?
Yeah, and I imagine there's quite a lot in women's health.
Yes, very much so. Particularly with the gender health gap, right? We just
It's
haven't had that
huge.
much time to study women and
Yeah,
women's health.
we haven't said it yet in this interview, but we always do. More research is needed.
Yes, more research is needed. I'm sure we'll get there. I'll say that more and more.
Plenty of times, yeah. So you've spoken a little bit about bacteria, but what about fungi? Are there things that show up in the vaginal and urinary microbiomes that are connected?
um, Particularly with fungi.
Hmm.
I didn't look in the bladder microbiome at fungi too much, although there is a couple of labs looking into that.
Hmm.
And really, the main fungi that we're concerned with at Evvy is, of course, Candida, which causes the majority of yeast infections.
Hmm.
Um, so I can't really speak to that as much. I don't know how the two are connected.
Yeah, it's an area like we hear from people in the community who sometimes think that fungi could be causing their bladder symptoms. And it's interesting because there's not that much research in that area to know if it is in the bladder or if it's coming from the vagina and causing irritation. So it's a big question for a lot of patients about whether, and this is what this whole interview is about, the interconnection, how you can even tell
Yeah,
where the symptoms are coming from. And it's a huge question that requires more research.
correct. Yeah, and I can definitely say Candida can cause UTIs 100%.
Hmm.
Um, and the way I think about it is, there's of course a lot of different sources of pathogens. You could be a sexual partner, or
Hmm.
a like a douching practice is not good for your microbiome, for example. But if you are, if some of the organisms are coming, say, from the gut, those
Hmm.
bacteria have to travel through your gut, get past the vagina to get into the bladder.
Yeah.
So if you have a healthy gut and a healthy and protective gut and a protective vaginal microbiome, then you just decreased the risk of the pathogens passing those two barriers in order to get to the bladder, right?
Hmm.
So there's definitely a connection. It is understudied
Yeah.
100%. um, but it is definitely there. So yeah, if you have a healthy vagina, you'll have a healthy
You mentioned that some people have symptoms, but what looks like a healthy microbiome. Are
bladder.
there symptoms that you've been able to link to specific organisms?
Yes, we actually just submitted a abstract, which is really exciting.
Oh, cool.
Um, yeah, for the first time, we've been able to show specific species are associated with vaginal odor.
Hmm.
So a lot has been hypothesized that certain bacteria can produce certain compounds. They're called biogenic amines that
Hmm.
are that cause bad smells. Um, One of them is putrescine, which you can imagine what that smells like. But cadaverine is another one. Um, and we were able to show that certain, I think we found 4 different Prevotella species and 3 other particular species are increase in abundance as people report an increase in bothersome odor.
Hmm.
And then we were also able to look for specific biogenic amine genes and saw that those also increase as people report an
Right.
increase in odor. So this is the first time that it's actually been past the hypothesis section and shown to be actually correlated with what
Yeah.
women are experiencing.
Well, that's great. Do you have other organisms and symptoms in mind for future research like this?
Oh yes, everything.
Yeah.
We want to look at itching. We want to look at
Hmm.
burning. We want to look at different types of discharge. Um, One other thing that this was an abstract we published, I think last year. I talked a little bit about how like bacterial vaginosis is dominated by anaerobic organisms, but
Hmm.
there's also, so that basically means anaerobic means it doesn't like oxygen.
Yeah.
There's also a group of bacteria that are called aerobic organisms that do like oxygen. And those are the ones that you probably think of more in the bladder, like E. coli, for example, is one of them. Group B strep. that type of a thing. And we did an analysis that if you had any aerobic organisms present in your vagina, you had more severe symptoms and
Mm-hmm.
more symptoms in general than if you had only anaerobic organisms present.
Okay.
So there is a correlation there. We haven't been able to tease apart like E.
Mm-hmm.
coli specifically is associated with burning, but we do know that having that present causes an increase in severity and just more problems in general.
Yeah. I'm sure we could find some volunteers if you want to pursue that research. But
Um,
there's also a lot of questions about how the microbiomes change. And one of the things that comes up a lot is sexual activity.
yeah,
People experience symptoms often after sex, but can you see changes in the microbiome because of vaginal sex?
definitely. There are studies that have looked at that. Sex just messes with the microbiome in general, right? There's things get moved around. There's new microbiomes getting introduced. So
Mhm.
the penis, semen, they all have their own microbiome, and semen can cause a change in pH. We know that if you use condoms, your risk of bacterial vaginosis goes down for people who have recurrent BV.
Mhm.
So 100% sex is one of the most significant triggers for vaginal issues.
Right. And what about things like a pap smear or a transvaginal scan? A lot of people report symptoms after something like that.
Oh, that's really interesting. I haven't actually heard that before. And yeah, there's no research on that that I've seen.
That's what I figured. So there's a lot of speculation about whether something new is being introduced or if it's a
Yeah,
mechanical problem that's just causing a disruption or friction or damage. But we do
yeah,
hear that a lot, and it would be great to have some research into that area of things too.
that's fascinating. Yeah, I'll put it on the list. I have
Okay,
a long
great.
list of studies that need to get
Well, and it's this,
done.
yeah, the same question for people who use a pessary for a pelvic organ prolapse that often is associated with an increase in UTIs. And I'm not sure if research has been done around that either.
It's been a while since I looked into the research around pessaries. I remember from a few years ago that it can definitely change the microbiome. Um, I mean, part of the issue is that pessaries are used for fairly long-term use, right? And they
Hmm.
can cause sores just where they're rubbing up against the side of the vaginal wall.
Yeah.
Um, but I haven't looked into that recently.
Okay. Yeah, but I haven't either. So I guess we'll both have to look into it now.
Do some more studying there.
Yeah. And so we've been talking about dysbiosis, but we're always told the vagina is self-cleaning. So how does it clean itself? And then why can a dysbiosis happen?
That is a great question. And um, how does it? I'll start with how does it clean itself? It cleans itself by creating mucus, right? That's what discharge is. It's the cervix creating mucus that is then pushing everything out through the vagina so that it gets foreign objects and potentially microbes out of the system.
Hmm.
But anyone who has tracked their vaginal mucus, say for like fertility or anything, we know that it changes in consistency throughout the menstrual cycle. And it's not coming out like with any force, right?
Hmm.
So if there's bacteria that have created a biofilm, remember that's a pretty thick, strong structure.
Hmm.
And something like mucus isn't going to have the capabilities of pushing
Yeah.
that. Think about it like if you have sex and your microbiome changes, like that is your trigger. And lactobacilli aren't able to recolonize fast enough. Instead, another bacteria comes in and is able to colonize.
Hmm.
Your vagina's self-cleaning capabilities aren't going to be happening at a fast enough rate to prevent that.
Right. Another time that people experience symptoms is just with their menstrual cycle as it changes
Yes.
throughout the month. Have you seen the microbiome change in your research in accordance with the cycle?
Yes, we haven't done any in-depth studies around cycles, but there's definitely literature on that. Um, it what we do know is that the microbiome fluctuates in response to estrogen, and
Hmm.
actually, the bladder microbiome does as well.
Hmm.
Maybe not by rates of cycles, but the bladder microbiome becomes more diverse following menopause, for example.
Hmm.
With uh, let's talk a little bit about estrogen first. So estrogen, when it's in the vaginal tissue, it allows the tissue to be thicker. It creates better tight junctions, so it's just healthier in general. But it also produces glycogen, which is a food source for lactobacillus. When lactobacillus can eat that food source, it can grow very rapidly and take up more of the space, again, preventing pathogens from entering.
Mm-hmm.
If you lose that estrogen for whatever reason, whether it's menopause, postpartum, fluctuations, just normal fluctuations in your hormone cycle, then the lactobacillus just loses its food source, so it can't grow as well. And that's part of the reason why we think we see those fluctuations throughout the menstrual cycle.
Yeah, it's interesting. And that's one of the reasons that things seem to change for some people. A lot of people ask whether there's any research into diet and how it might impact the vaginal microbiome.
Not very much,
Mm-hmm.
unfortunately. Um, all of the diet microbiome work is in the gut, and I know it's very frustrating again to say more research is needed, but probably the only connection there is what I was saying before: healthy gut, healthy vagina, healthy bladder.
Yeah.
So if you can decrease the amount of pathogens, whether that's Candida or E. coli in the gut by diet, then that potentially has the downstream effect
Mm-hmm.
of preventing pathogens in the bladder.
Mm-hmm.
But yeah, the research is very, very sparse.
Yeah, and it's a huge area of interest for patients because a
Yeah.
lot of people do find that changing their diet impacts their symptoms. So it would be really great to see more work done in that space.
And there's been some work looking at bladder irritants potentially. So,
Mm-hmm.
like some people can't drink coffee because it causes them bladder pain, for example.
Yeah.
But that hasn't been correlated to the microbiome in any way.
Okay. Yeah, it would be interesting to see.
Yeah,
And you
it
mentioned
would.
that douching is a bad practice. It can disrupt the microbiome. But what about using a bidet after using the bathroom? Do you think that could be positive or negative in the same way that douching is?
That's also a great question that has not been studied, but I have wondered about it myself.
Yeah.
Um,
A lot of people
and
have sent this question over the years.
yeah, maybe we need a bidet study as well.
Yeah, I
Um,
think it would be beneficial.
so I unfortunately can't answer that because we just don't know.
We'll just keep that one on the list then.
Yes,
And a couple of people asked if steroid creams impact the vaginal or bladder microbiome and if that's even known yet.
it's not known, but it is. I know certain steroids help with certain types of conditions. Its effect on the microbiome is unknown.
Hmm. Have there been any studies into whether the microbiome impacts the ability to conceive?
Yeah, that's a super interesting area of research. There's actually a lot of interest in that right now.
Hmm.
And um, it looks very promising.
Hmm.
I'll say that for sure. What we've seen in a lot of observational studies of people who have um, something like recurrent implantation failure of IVF, so like um, an embryo is put in, but it just doesn't take, it doesn't create
Hmm.
a viable pregnancy. Um, we see that the people who have that problem tend to have a more diverse microbiome,
Hmm.
non-lactobacillus dominant. And it's unclear the mechanism behind that. We don't know why. The theory is that the diverse microbiome is somehow causing like low level, low grade inflammation somehow
Hmm.
that is making it unlikely for the pregnancy to succeed.
Okay.
That there's a couple really cool studies that we're looking at. Can you change the vaginal microbiome to
Yeah,
then increase rates of conception?
that was
And
going to be my next question.
yeah, it looks like maybe. So
Okay.
there's only really one study that has done it fairly thoroughly, and this was done in Japan.
Hmm.
Um, and what they did was a type of vaginal microbiome sequencing before they did, antibiotics and probiotic or combinations thereof, and
Hmm.
then check the vaginal microbiome again. So kind of they wouldn't do the embryo transfer until the microbiome was in a lactobacillus dominant state.
Okay.
And they compared that cohort that went through this really intensive microbiome treatment to a cohort that didn't do anything. They just did sequencing, but they didn't follow up on that. And
Yeah.
what they found is that the microbiome shifting actually did help and did improve outcomes for that cohort, which is very neat.
Wow, that sounds really promising.
Very promising. But it was only done once. It
Yeah.
needs to be redone
Yeah.
on a more diverse population of people in a larger study, that type of thing. But it is
Yeah.
very promising.
Has that research with the microbiome been carried through into pregnancy itself to see whether there's an impact there too?
We do know that the vaginal microbiome is has some signals for predicting things like preterm birth.
Hmm.
So, and we've also looked, or not we, but lots of research has been done looking at the microbiome over pregnancy, right?
Hmm.
There is so, we talked about hormones. There's so much going on with hormones
Yeah.
when you're pregnant. Um, so, uh, there is a shift, like people tend to become more lactobacillus dominant by the end of pregnancy. And then once you have the pregnancy, you have a massive hormone drop. You know, postpartum is kind of considered the mini menopause, and that's kind of what you see is that the hormones are taking a while to bounce back,
Hmm.
and that correlates with shifts in the microbiome.
Hmm.
So that's in a healthy pregnancy. That's what happens. What a lot of research is finding is that if you sequence the microbiome early, say in the first trimester, there are certain signals that potentially can predict if the if preterm labor will occur. Preterm
Hmm.
being less than 37 weeks gestation. There's people who have looked at bacterial signals, metabolomic signals. There's a ton of research in this area right now, but we don't really know if we can shift the microbiome after you find that signal in the first trimester,
Right.
right? Because then the hormones are taking off.
Yeah.
So once we find that signal, what can we do about it is
Hmm.
still a little bit an unanswered question.
Yeah, but so important for so many people.
Yes,
So it
it
would be
does.
great to see that research done too.
Hmm.
We've
And
talked,
there's people working on it.
yeah.
Live biotherapeutics are hard.
Yeah, definitely. And we've talked a lot about the unhealthy state of the microbiome. What do you think about people testing when they don't have symptoms? Is there any benefit to doing that?
Yeah, because you need a baseline. You need
Hmm.
to know what your microbiome looks like when you don't have symptoms, so you know that when you do have symptoms, what has changed, right?
Hmm.
Um, like I said, there is a lot of people with a diverse microbiome that are asymptomatic. So if you were only going to test when you're symptomatic and you have diverse microbiome, you'd be like, oh my God,
Right.
things are wrong. But if that was your baseline at like before, maybe it's not just Gardnerella. Maybe it's like we're saying you got a low level of a aerobe there. And that's
Hmm.
really the problem that you want to actually look at. And those types of shifts are really good to know for your own
It makes
education and knowing
sense.
about your
I'm
body.
sure a lot of people test for the first time when they have symptoms, though. So, how do you
Definitely.
know what you're looking at and what to recommend treatment for?
We base everything off of the literature and medical recommendations.
Hmm.
So we will, uh, we, um, Evvy works with doctors that use our tests to help prescribe medications.
Hmm.
And those doctors will decide based on the results and the symptoms if treatment is necessary. So I am a PhD. I do not like to talk too much about
Yeah.
medications, um, but it's all evidence based.
Hmm. Well, we could talk about the research potentially into certain treatments for vaginal dysbiosis. So, is there
Mhm.
research around like oral probiotics or antibiotics or anything else, boric acid, the things that people often talk about when it comes to
Mhm.
vaginal infection?
Yeah, let's start with probiotics.
Hmm.
Um, there have been a lot of research on probiotics with a lot of very confusing results. One study will say one thing and another study
Hmm.
will say another. Um, and we recognize that that can be really challenging. But what we do know, or I should say, what we, the reason for that, the reason that there's all these different results comes down to the fact that the the organisms, the study design, and the outcome measures.
Hmm.
are all different across all
Mm-hmm.
of these different studies. And so it's really hard to say, was it the organism? Was it the study design? Was it the outcome? Like,
Yeah.
what part of this didn't work? We do know that if you take an oral probiotic, that can affect your gut microbiome. We don't know if it has a corresponding effect to the vaginal microbiome in the majority of people. Some
Mm-hmm.
people, yes, but not necessarily enough to be statistically
Mm-hmm.
significant. People have tried to track like the strain that someone took as a probiotic. Could you find it in the gut? Could you find it in the vagina? Could you
Mm-hmm.
find it in the bladder? And the answer is yes for the gut, sometimes for the vagina. But we don't know if that's a sampling time point issue,
Mm-hmm.
a transfer between those sites. It's hard to say.
Yeah.
When we look at a vaginal or topically applied probiotic, we do see that the strain is there temporarily, but not long term. It doesn't.
Mm-hmm.
It's called engrafting, right? It doesn't engraft per se.
Mm-hmm.
And there's a couple reasons for that. The first is most of the strains that are approved for use in the US are not originally from the vagina.
Mm-hmm.
They're from foods, yogurts, and that kind of a thing.
Yeah.
So these are not lactose that really want to be there.
Yeah.
But they do potentially help kind of hold the hand of the microbiome as
Mm-hmm.
it's recovering. So say you've taken an antibiotic and it's just wiped out your vaginal microbiome. You want something to be in there temporarily so that bad bacteria don't colonize to
Mm-hmm.
give your native lactobacilli a chance to regrow.
Yeah.
So that's probiotics. Was there anything else in there? That
There is, but that
aspect
makes
to
sense
cover?
what you said about the probiotics based on patient experience, which is that many people say they feel better while they're using a vaginal probiotic, but then the benefit
Mm-hmm.
of it disappears when they stop using it. And so,
Yeah.
is there a way to permanently improve the vaginal microbiome, or is it a placeholder while your body does what it needs to do and rebuilds it?
There's a couple groups that are trying to do the research on vaginal specific organisms for,
Mm-hmm.
so like Lactobacillus crispatus, Lactobacillus gasseri. There's a company called LactMB that's looking at a crispatus treatment.
Mm-hmm.
And there's a couple groups that are looking at consortia, so like a combination of different bugs that would
Mm-hmm.
be given as a treatment. But all of that is fairly early stages and
Right.
they're still going through like the clinical trials process, which is really hard for, like I said, a live biotherapeutic because it's a new frontier for the
Yeah.
FDA.
Yeah.
Yeah,
That's, I mean, that's what one of the problems is for patients too, just accessing things and
exactly.
wanting to try things, but not being able to, wanting to participate in clinical trials too. So there's a lot of interest in the patient community for these types of therapies.
Yeah,
But the other
and
questions
that's
were,
exciting.
it is exciting. If only there were more trials so more
If
people could
only.
join. And yeah,
Hmm.
that's the goal, right? But the other question was, you mentioned just in passing that oral antibiotics can decimate the vaginal microbiome.
Hmm.
Is that always the case when you take antibiotics or just with some types?
Just with some types. The main treatments that have been studied on the vaginal microbiome are clindamycin and metronidazole,
Mm-hmm.
both of which preferably you would take topically, but not everyone can.
Right.
I'm not as sure if you're taking something like amoxicillin or penicillin, how big of an
Mm-hmm.
impact that might have on the vaginal microbiome, but I can imagine that it would to some extent. Any antibiotic that you take orally is going to affect almost every system of your body that has a microbiome.
Right.
Um,
And does that go for, so we've talked about good bacteria, but some people report having an overgrowth of good bacteria that causes symptoms.
yeah,
Are there known treatment methods for that?
great question. That is a condition called cytolytic vaginosis or CV,
Mm-hmm.
and it's an overgrowth of bacteria, potentially a lactobacillus. So it's a very understudied condition, but the
Mm-hmm.
literature that's out there shows that if you have too much of lactic acid, that can actually cause irritation to the vaginal lining, which is pain, itchiness, that type of a thing.
Mm-hmm.
We don't yet know exactly which organism causes that or what the threshold is for the level of lactic acid or bacteria that you need to have in order to be diagnosed with CV because the literature just hasn't been done yet.
Right.
And it's really not a common or even accepted diagnosis
Hmm.
in the US, more so in the EU.
Okay.
In the US, it's very challenging to have anyone even kind of admit that it's a condition.
Yeah.
Um, the papers that had looked at it, there's a really easy treatment. The first thing is stop any probiotics you're taking. So when we talk to doctors, they're like, if I diagnose someone with CV, they're probably taking way too many probiotics. And
Mm-hmm.
if you stop the probiotics, sometimes that's all you need, and your body will go back into balance and it all
Okay.
goes away. So there can be too much of a good thing.
Right.
And so that's the first thing. If it still doesn't go away, you can, it, it's called a sitz bath, SITZ,
Hmm.
and it's a sodium bicarbonate water solution that you sit in, and that is just changing your pH. So it's just killing off a little bit of your lactic acid bacteria so that the amount goes down and everything kind of goes back into balance.
Okay. And are there other strains of probiotics you could use to balance the overgrowth of a good bacteria?
No, just stop taking probiotics for a while and see
Okay.
how your symptoms respond. That would be the
Right.
first step for sure.
So, what are antimicrobial peptides, and do you think they have a place in the treatment of UTI and bacterial vaginal infection?
Great question. Antimicrobial peptides are, or AMPs for short, I'll probably use the acronym, are
Hmm.
small compounds that are produced either by the host or by bacteria
Hmm.
that are that you've evolved them as a host to kill off certain bacteria. So it's an immune function.
Hmm.
So immune function either that the epithelial cells are producing or that other bacteria, like bacteria to bacterial warfare, basically. And there's a ton of different kinds. I am not up to date on all the different varieties, but they do show up both in the bladder and vagina
Hmm.
very prominently. I am not up to date on how that is being used for treatments. I haven't really
Hmm.
seen as much literature on that, although I know that some people are working on it. I just don't know the state of that literature.
Okay. So, what is considered normal for a vaginal pH, and is it possible to change it?
Yes, it's very possible to change it. A normal pH is usually less than 4.5, I believe.
Hmm.
Um, so it's fairly acidic. The Like I was mentioning before with CV, you can easily, if it gets too acidic, you can make it more basic.
Hmm.
You can also, there's a whole bunch of different um, new treatments out there that are using lactic acid as a component of the
Hmm.
treatment. So like a vaginal gel or something like that with lactic acid built in to try and automatically change the vaginal microbiome and the pH.
And can that then change the microbiome, or does it just help with symptom relief?
Yeah, the reason lactobacillus produce lactic acid in general in the vagina and why we think we kind of co-evolved together to do that
Hmm.
is that it's toxic to some of those pathogens. Lactic acid actually kills different bacteria. Lactobacillus love it, but a lot of other bacteria don't.
Right.
So it is that's part of the protective effect that lactobacillus actually has.
Overall, in your research, have you seen that it's possible to permanently change the vaginal microbiome to a healthy state?
Permanently, no. Yes, you can change it to a healthy state, but things are always going to happen, right? You have sex, you're during your menstruation, you go through menopause, you are having an incredibly stressful time in your life. Things are going to shift your microbiome. So having a protective microbiome will help prevent episodes from happening more frequently. So if you have recurrent BV and you have a healthy microbiome, maybe you'll have fewer episodes in a year,
Hmm.
but life happens, right? And things happen. We're just not going to be able to say anything is permanent when it comes to microbiome.
Yeah, I think that's fair. It's better just to understand that process and work towards a healthy state whenever you can.
Exactly, whenever you can.
Yeah.
And know, and then you have the knowledge when something else happens, like, okay, this was my trigger. This is what happened. Now I'm going to go work on fixing it.
Hmm. And I think the testing can help with that for a lot of people.
Yeah.
And we often get the question, like, how can a patient advocate for themselves if they are seeking to do a test like an Evvy test or a different kind of test for the urinary microbiome? How can they talk to a doctor about that and have that doctor take it seriously?
Um, for the Evvy test, you can just buy it on your own from the comfort of your own home. You don't need the doctor
Hmm.
to approve it. Um, so that's easy. When it comes to bladder tests, because I don't know that many on the market right now that are direct to consumer,
Hmm.
going through a physician, I would say, Live UTI Free has a great handout that you can print
Hmm.
out and take to the doctor to help explain what the bladder microbiome is and how you're thinking about recurrent infections and helping you advocate for your own care that way. And I always say this, and I know it's so hard in the US where, your doctors are determined by your insurance. But if your doctor doesn't believe you and you're being gaslit, just go find another one.
Hmm.
There are a lot of doctors out there. And if it doesn't work for you, there's no reason to stick with them. Like,
Yeah. Yeah, it is tough. We can provide some information about clinicians too if people want to reach out for that. But yeah, you're right. It can be hard to change because it can be out of network or it can
yeah,
just be impossible to pay
exactly.
for someone else. So it's a struggle.
It is. And I
Yeah.
100% recognize that.
Yeah. Well, that comes to the end of our list now of questions. Thank you so much for joining us again to answer them. I'm sure there will be another opportunity in the future with more questions.
My pleasure. This was lovely. Thank you so much. And I look forward to next time.
Thanks so much for watching. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveutifree.com for articles related to this video. And be sure to check out Dr. Thomas-White's first interview. We'll drop the link in the video description. If you like what we're doing on this channel, please support us by hitting subscribe and ticking the bell so you'll be notified of our future content. Thanks so much for watching, and until next time, keep asking questions and pushing for better solutions.